Hi there. Hi, everybody. I'm Dr. Idee Charles. Um, I'm making this video to address my concerns about the health sector of Nigeria. And I'm making this video because of the recent happenings that I did watch on national TV. It was on live TV that I watched. Whether crook or real, somebody fainted in the National Assembly or National Senate, House of Senate, where there was a hearing and somebody fainted. Some people say didn't faint, but I saw beyond the fainting. That's why I'm doing this video. I saw beyond the fainting. I looked at the man. I said, what if this man actually collapsed or fainted or just collapsed? What if this was real? What if he needed attention? What would have happened? I watched people run to him, rush to him. I mean, so many maneuvers going on. Some people jumping on his face, some people pouring him water, some people giving him a bottle of malt, opening his mouth, putting on stuff, some people using paper to fan him. And I'm watching and I'm wondering, this is a serious problem. This is a serious problem. And the reason I'm doing this video is to address the Nigerian people, to address the lawmakers, to address the senators, to address the representative of the House of Assembly, to address the House of Rep, to address the governors, the ministers. I'm asking you guys, do you really think about yourselves? Do you think about your health? Do you think that something can happen to you and you need emergency care? I watch people, you gather and all you talk about is this billions, 80 billion, 20 billion, 10 billion, 4 billion, all billions, billions, billions. How these billions have not been accounted for. Nobody cares about the health sector. Nobody cares about your health. You don't even care about your health. Why am I saying that? Because in the whole of that room where all of you top lawmakers, top politicians were sat, nobody could do a simple face aid. There was no face aider. There was no protocol I could see in place that somebody even knew what to do, the actual ABC. Nobody knew what to do. I saw people jumping on this man's face, on his neck. I saw people giving him bottles of water and malt. I saw people bringing out paper and fanning him. I saw nobody that actually knew what to do. And I'm asking you, what if you actually collapse? What if you actually faint? What if you actually need emergency care like right now and you fainted in that auditorium? What if you fainted in a venue? What would have happened to you? Have you guys actually thought about yourselves? Have you thought about that health is not just about the poor people, that the policies you make, it affects you? Because when we talk about health, it's not just about poor people, it affects everybody. Health is something that is important. It's important because it affects everybody. Anything can happen to any of you. So let's take, for example, you collapse. You collapse probably of low sugar, or you had low sugar and you collapse, or you're diabetic and you collapse, or you're hypertensive, or you had a stroke, or something just happened and you collapse. You need attention like right now. Or you swallowed something and you choke and you collapse. Probably a little bit of oxygen can save your life. Probably you're asthmatic and your chest is so tight and you have low oxygen and you collapse. You just need a little bit of helping at that spot to help you stay alive. Why would all those simple things kill you? Because we don't care. And because our eyes are so fixed on money, we have forgotten even the basic things that affect us, like health. Look at the hospitals. Look at the health. Just look, use your eyes, use your imagination. Look across the country. Look at all the hospitals. They are not equipped. They are not, no staffing. Let's look at manpower. Do you equip these doctors, these nurses? Do you train them? The hospital walls are up, just like a forgotten, abandoned building properties. Beds are broken. People are lying in places like pigs. There is no emergency care. Let's even come down to the local government, the local communities. Nothing. No health support workers, no community workers, nothing. You go to the state, look at the state government-owned hospitals. It's an eyesore. You go to the federal teaching hospitals. You don't equip these places. Even your own state or federal or national clinic, you don't equip them. You don't even train yourselves. So what if something happens and you need emergency care? You will die. Don't tell me I have private jets. I have my doctor in Dubai. I have my doctor in India. I have my doctor in Germany. I have my doctor in Britain. Because something happens to you and it's an emergency, my dear, you will not be able to get onto that your private jet. And let me give you people a clue. Sometimes we forget or we assume. Let's assume you have a stroke. Assume you have a stroke. A stroke is time saving. Without time, we can't save the brain cells. If they die, a stroke is a permanent damage. People will tell me after 2 weeks, I'm flying to Germany to get care. You're not going to get care. You're going to get rehabilitation. The damage has been done. But the good news, if you were taken from the spot to the hospital to have a thrombolysis at the time, you would have been saved. Part of those brain cells that died will not die. And you just need to get facilities in place. All these billions you guys are calling, we would have world-class hospitals, well-equipped manpower. But what is happening? Doctors are leaving because there's no hope for them. They want to train, they want to get better, they want to have, with their knowledge, with all the years they spend in hospital, they want to have at least a place where they can practice medicine well. You're not providing nothing. So they're having brain drain. People are living. And you think it's okay to just be amassing money, amassing cars, amassing houses. And some of you are dying. You collapse and die, oh, he died. Oh, he died. The things you are dying from, you shouldn't die from them. The things you're dying from, think about your children. What if they collapse in your house? Tell me, are there any effective ambulance services in the country? None. Are there any effective paramedics in the country? None. What then are you guys doing? This is about you and your health, at least your immediate family. You're not thinking. You're not thinking right. You're not doing right by yourselves and the nation. People are dying every day. You hear sudden death. We regret to announce a sudden death. And these people are young, 35, 37, 40, dying because there is no health care system that is functional, that is effective. You've got to think, what are we really doing? If a nation don't have a health care system working, what is the point? Why are we every day wearing suits and going to say I'm a lawmaker? What law are you making? Most of you have chronic illnesses. You are living with chronic conditions. You're living with diabetes. You're living with high blood pressure. You're living with kidney problems. You think you always fly out all the time? Has this COVID-19 pandemic not taught you any lesson that you need to fix your health system? You need to fix your health system. It's enough. People are just dying for things they shouldn't die of. They run to places they shouldn't run to because they need help. In the hospitals, they have no hope. They go to private clinics and they can't afford it. You guys can afford all these private clinics. What if you have an emergency? The private clinics will say, oh, go to the government hospitals. We can't deal with it here. How many people can afford all those high-class private clinics? Think. It's unfair to the whole nation. It's unfair to the citizens to allow the health sector to be in this deplorable state that it is. We've got to do something. And my plea today is, please, you need to put healthcare policies, healthcare sector as a priority. Let COVID-19 teach you. Let it waken you up. Let it wake you up that healthcare is a priority in any nation. The borders have been shut down. You cannot travel. So you still need the local doctors. You still need the people at home to help you. You need to equip them. You need to train them. You need to provide an environment, a hospital where it is equipped, where they can walk. We can't continue like this. Somebody will collapse on the street. There is no emergency service. Somebody will have a road traffic collision, an accident, open fracture like a broken bone and dies from it. Somebody will have a head injury and dies from it. Simple things that can be treated. Simple things that lives can be saved. But you are overlooking all these things and pursuing these billions. What do you really think you will do with this money when you're dead? Supposing you collapse and die, those monies you stack up will not save your life. You need people, manpower, well-equipped, environment, equipment, cars, something that will rush to the scene, take you and save your life. That's what you need. That's what you need. Not the drama we saw, and you showed it to the whole world that, look, these people, there is no help. If somebody collapses, that's it. If somebody faints at home, that's it. Before they go to the hospital and somebody will say, you need to pay money for card. We don't have drug. Go to that pharmacy and buy drugs. And the person has died. My plea to the Nigerian politicians, the lawmakers, the senators, House of Rep, governors, ministers, Minister of Health, you need to wake up and do stuff. You need to change the status quo. You need to do something. People should not continue dying like this. You need to put in policies in place. There has to be emergency services running across the country. They've got to be ambulances, paramedics running across. This will even help create jobs for the young people. You train them, you equip them. They will save your life, your life. Let's start with your life before every other person. But every citizen of Nigeria, their life is important. People should not just die like that. We need to do something about the health sector of Nigeria. We need to do something. We need to put things in place. It's enough that people are dying things they shouldn't die of. It's enough. It affects you. It affects every citizen. It's not just one person. So let's do something. Let's rise up and save the health system of the country. Thank you so much. I remain Dr. Idee Charles. Thank you and God bless.